So it's my pleasure to introduce Dr. Kim Baker. Kim is an assistant professor of health promotion and behavioral sciences and the director of the Office of Public Health and Practice and Engagement at UT Health School of Public Health. Dr. Baker uses community-based research methods and practice-informed strategies to improve health service delivery. Kim's work is aimed at eliminating health disparities and reducing the impact of racism, particularly in the area of reproductive and sexual health. On the Own Every Piece project, she and her team are developing and assessing system-level interventions to increase healthcare access for women marginalized by systemic barriers. Her research interests include contraception access, maternal health, bias reduction, and communications and social marketing. We look forward to hearing from Dr. Baker today as she talks to us about inclusive messaging in a world apart.
Good afternoon, everyone. It is such a pleasure to be here with you all today on this first Texas Public Health Summit. I truly believe that our mission in public health is to protect and promote health for all, and I mean everybody. And we all know that that is a very hard task for some. In fact, since the beginning of my career, if I even think back to before I started graduate school and I was telling family and friends that I was going into public health, and they would ask me, what is that? So what would you be doing? And I would scramble to find the words to describe what it was and what I would possibly be doing in this career. I would say simple things like, well, you should just know that public health is connected to everything, right? And hopefully that would land somewhere, and folks would just kind of look at me like, I hope that works out for you, Kim, whenever you figure out what you're doing in public health. Because mind you, I would be talking to friends and family of mine that would be starting law school, medical school, nursing school, getting their teaching certificates and things that seemed a little bit more tangible into the work that they were going to be able to do. And so those conversations would always land flat at the beginning of my career. But it did work out for me. I received my master's, then my doctorate, and along the way, I chose to focus on topics that were even much harder to talk about than public health. As you heard from the introduction, my work focuses on sexual health, reproductive health, and racism. Yikes. But on this path, honestly, truly, I was forced to connect more deeply with people, learning just how public health fits within their lives. I started to become an expert of sort among my friends and my peer group once I got into that cadence. They had questions about universal health coverage, my friends, and wanted to know my opinions. Maternal mortality, wanted to know my opinions on that. And especially my friends who had kids that were going into middle school, the dreadful, how do I talk to my kids about, the talk? And so my pride grew tremendously here. I said, they got it. They know what I do. It felt really great. Not because they finally understood what I do, but because we were finally speaking the same language. I had the words that could match what they were needing to hear and get from me. I felt that what I could share to them was valuable, that it benefited them in some particular way. There was something that they heard outside of me that resonated with them, that they sought out to have a conversation with me. They wanted to seek answers. So truthfully, it was those experiences coming into the field and making my way through the field of public health that really validated my reasons for being in this field. I felt if I could not have conversations with my friends and family who knew me and who trusted me and who loved me, how could I ever develop messages for people who did not, who were strangers, who were complete strangers and did not trust where the source came from. And so it deepened my resolve to commit myself to that very notion, finding a way to connect with the public that includes them, that validates their experiences, and so that they can benefit from the message that I share. I'm sure many of you listening today can resonate with this experience. We all come to this work with a true passion, and the joy we get when people finally get it. Understand us is sometimes indescribable, but this can also be a burden. Enter 2020. This has been the theme for today. So in many ways, we always say that COVID was our moment. It showed people what we have been trying to explain for years. Public health is connected to everything. But were we ready to meet that moment is the question that I ask ourselves, right? And that we continue to ask ourselves. What about our messages? How did they land? Did some resonate more than others? Did some just fall flat? And why did they fall flat? I'm sure we all have thoughts and we all have answers to this, and we've had some conversations earlier, and we will continue to have those conversations this afternoon. In my opinion, there was no bigger learning from COVID than the one of communication and messaging. And I say this definitively because in my role at the School of Public Health, I get to assist students with being placed in their practice assignments. So the very training of them to go into the public workforce. And when we hear back in these past 2 years from those host sites, we ask them questions about what do you think about our students? And they think that they're amazing, of course. Then we ask them questions about what do you wish our students could do more of for your agency, your institution, your organization, your healthcare organization? And they say communication. Sometimes they say data analysis for sure, but most times it's communication. They want to know if their students can help them figure out what to say, how to say it, when to say it, who to say it to, what is the impact of the messages. And more, increasingly, we're getting institutions that say, can your students just run our social media campaigns? We said, well, not quite yet. But let's have a discussion about how we can further train our students so that when they're ready to go into the public health workforce, they come with these skills, these very, very, very critical skills around messaging, specifically messaging that's inclusive. So many of these sites that we work with realize that there is a gap in our messaging. And at sometimes, even in our current time, sometimes that gap feels insurmountable. So you should know I titled this talk Inclusive Messaging in a World Apart because I think it's very necessary that I underscore the collective feeling of our public health profession at this time, coupled with the increasing anxiety in our nation as we grow and shift into realities that are unimaginable for many. It feels that it's becoming increasingly hard to do a job that we've always known everybody needs because, again, it's connected to everything. So in alignment to this year's summit theme, our goal is to foster trust, to make sure our communication is effective. But we must ask ourselves, what should we do to make our work, our messaging more responsive in a way that ensures everyone's safety while we acknowledge the polarization of our nation? In a recent article written by David French regarding the three Americas, he states, at this moment in history, there is not a single important cultural, religious, political, or social force that is pulling Americas together more than it is pushing us apart. He goes on to further state that there are three Americas: red, blue, can anyone guess the third one? And it isn't a color. He said red, blue, and exhausted. And the majority of us fall into the exhausted category, 2/3, truly. In fact, a study published by researchers from Johns Hopkins found that an uptick of public health leaders during the pandemic have left the profession, citing burnout from the divided public and their experiences, which included social media harassment, family harassment, and overall career dissatisfaction. These researchers called for interventions to train public health leaders to respond to political conflict and improve colleague support, right? To heal trauma, to heal pain and dealing with disagreement. That we need to prioritize our workforce's well-being and safety by implementing policies that undermine intimidating behaviors. Simply put, we are tired, but we are here. Thank y'all for being here today, again. So now, those friends and family members of mine know exactly what I do. So much so that they wonder how in the world I am in Texas doing this work. Just so you all know, I'm not originally from Texas. I'm originally from St. Louis, Missouri, but I've been here for 15 years. They say things like, Kim, I don't know how you do that. Are you sure you want to do that work there? And in full transparency, there are moments that I think to myself, do I love this work that much? And I'm reminded, indeed I do. I'm also reminded why I decided to move to Texas some 15 years ago. I was drawn here because the value of independence, boldness, and audacity resonated with me, and I couldn't get to Texas fast enough. So whether you were born here or migrated here, we all hold that same shared value that here in Texas, we will do what's needed and what's necessary. Bold and big ideas. Go big or go home, they say. It is this same shared value that requires us, public health leaders, both seasoned and emerging, to be more bold in our messaging in ways that includes all in these divided times. So how do we do that? When we say things like build trust, what does that really look like? And when we use terms like inclusive and equitable, what does that translate into? How do people hear those terms? The CDC defines inclusive communication as communication products, messages, and strategies that adapt to specific cultural, linguistic, environmental, and historical situations of each population or audience of focus. And according to the Harvard Business Review, an inclusive leader sounds like one that takes themselves out of the message. Specifically, they make an effort to put their audiences first and adapt messages to their needs, values, and interests. For us in public health, taking ourselves out of the message may mean shifting from our default of solely sharing facts and data to elicit behavior change, to including along with these facts, a shared language that elicits an emotive response from our audience. This is not easy. And we saw proof of this in several different areas, whether, of course, if it was masking behaviors or vaccine uptake, simply telling people to do something because the research supports it was not going to get us an effective, inclusive messaging. In fact, the truth may even slow the messaging, unfortunately. Are you all familiar with the saying that a lie is halfway around the world when the truth is just putting their shoes on? Well, actually, according to a study published in Science magazine that collected 12 years of data from Twitter, The truth, facts, science, and data rarely reach 1,000 Twitter users, while false and misleading information consistently reach over 10,000 Twitter users. And they found that there were two main reasons behind this shocking finding. First, the false information was new info, novel info, something that people hadn't heard before. Second, the message elicited emotional reactions. So where does this leave us? It brings us back to emotions. And the only way we can effectively communicate with messages that evoke an emotional response from diverse audiences is to build authentic relationships and invest in the process as the outcome and not a step to be completed. And so that's very important for us to understand that that process that we talk about, the process that we say costs a lot of money, and a lot of times there isn't a financial motivation to build these relationships, but this is something that we really have to think deeply and creatively about, and how do we sustain relationship building so that we can resonate our messages with all audiences. There are many audiences that we need to engage. So this means for some, it's building relationships, but for some, it's also repairing, right? There's broken trust in many communities from places and institutions of authority. And then it's strengthening relationships for others. So for us, there are really 3 steps to getting to a more inclusive messaging. And those 3 steps include shared values, 1, 2, shared language, and 3, building this diverse and inclusive workforce to be able to carry out and sustain these changes and shifts that we need. So first, we have to identify our shared values with such a diverse and varied and ranging public audience. Just as we have the shared value in Texas of boldness and independence, the communities we serve deserve our energy to discover what it is that we share with them in the interest of health specifically. When we can, we must base our messaging and our shared values, as people typically accept messages that fit within their core belief system. Now, as I mentioned earlier, my work is in reproductive and sexual health and racism, and my work is in Texas. So if I can work to determine shared values for messaging in my work, then it is definitely a feasible step for all of us. You should know that I direct a campaign to improve access for reproductive health for women. That campaign is entitled Own Every Piece. In the very name of the campaign exists the shared value of ownership. And we got to that name through message testing and working collaboratively with the women that we prioritized, who were going to be our campaign audience. It's about autonomy and personal decision-making. It is because of this, our campaign was able to develop messages that resonated with tens of thousands of women in the Houston area. Even before COVID, because of the sensitive nature of my work and it being such a polarizing topic, we've always used techniques such as message testing and framing, and we engaged a wide range of community members in our work to help develop and hone these messages. So whether it was formerly incarcerated women that we spoke with and listened to, or Baptist church secretaries, everyone had a voice, and we wanted to connect what everyone felt similarly around the issue of accessing reproductive health, no matter their political leanings or religious beliefs. Out of that work, we were able to create some of the best strategies that we currently use in our campaign. And this has come up in the talk before. We implemented in 2019 our micro influencer strategy, where we hired and worked with 20 micro influencers who were women of different ethnicities, faith backgrounds, life experiences, none of which included public health. They themselves were not public health experts, but they all had the shared value of understanding how important it was for them to be able to make their own decisions about accessing the reproductive health that they needed. Working in collaboration with those micro influencers, it was easy for us to develop a message that had a shared value. We actually co-created messages along with these women. We didn't say, here is a flyer, go post this, although that is a common method and strategy and could work for some topics. But because our topic was such a polarizing topic, we leaned into how the women were feeling and who their audience, who are they accountable to, and allowed them to create messages within our frame that responded to that. And so that took a lot of trust for us to be able to do that with this strategy. And it has worked tremendously. In fact, in 2020, we received the American Marketing Association's Crystal Award for the Houston chapter for this work. But to help you get started on this journey, because of course, I'm sure your work looks very different from mine, you should know that starting with thinking about establishing shared messages with your audiences is critical to this first step of inclusive messaging. What we also know is all humans have a shared value about the human potential, human connection, and a change outcome. And so starting there are 3 critical ways that you can lean into thinking about the shared values that you may need to explore deeply with the communities you serve and work with. So that was shared values. Second, we must have a shared language. And shared language is one that is not dismissive and it's not audience blaming. And we recognize that access to information is simply not enough. People need information that they can understand and use for sure. And so this starts by changing the language that we use. A lot of times we use language that says this group is hard to reach, right? But if we flip that on its head, sometimes maybe it's difficult for us to engage. Somebody's reaching the group. We're having issues reaching this group. So let's go there, right? Or non-seeking health behaviors, unengaged, right? These are topics that we are terms that we have to shift from because we need to take ourselves out of the messaging and the planning and really center the experiences of the audience that we're trying to reach. We also need to consider ways to improve the accessibility of content, alternative forms of communication and formats. We've spoke about other materials and other languages, right? But also using language that is accessible and meaningful to the audience of focus. So with our micro-influencer campaign, we were extremely influential during COVID because they were able to actually pivot from sexual health messaging to a messaging around vaccine uptake. They had already solidified their credibility with their audiences from the health messaging that they worked on with our campaign. And so when things were shut down, we also were able to allow our micro influencers to tap into the needs and the concerns of women that followed them. They were getting direct messages, or how the younger folks say, DMs, constantly about what do I do because I can't go to the doctor. I need to go get my birth control, but we're in a shutdown and I can't get it. And you all should also know, in terms of women's health during the COVID pandemic shutdown, the rates of domestic violence and intimate partner violence went through the roof, right? And so there were situations where we had women in violent and reproductive coercive relationships, and they weren't able to make decisions about their own bodies, but were able to reach out to our micro influencers, right? To where we decided and took that information to reach out to our medical providers that we work with in community, some awesome FQHCs, some private family practitioners, and some of our community health clinic partners to implement telemedicine just for reproductive health. These places weren't doing that for reproductive health. They were doing that for chronic disease management well, but they hadn't even thought that there was a need to do that. But the pandemic allowed them to shift, and our messaging and the relationships that we built through our micro influencers, we were able to signal that information up to the chain to leaders in these health serving organizations to change their service line. So we were really excited about the human connection and the countless of women we were able to support during the shutdown. And even that continues to this day. So we must remember that successful community engagement is a continuous process that builds trust over time. We had the pleasure, the privilege of being privately funded for at least 3 or 4 years to help us get to the development of this campaign. That is rare, right? You know, with private foundation funds, we were literally able to sit and build relationships, which is something that you can rarely do a lot of times with federal funding. But it allows us to now be in a better place to test the interventions that we develop through private funds and through that support with more federal funds. And so we are excited about the future of this work with micro influencers and a plan to expand it outside of Houston and Harris County and across the state of Texas. Lastly, on this topic of shared language, inclusive message must be intersectional. This means that individuals, we should all know, belong to more than one group. And so therefore, we must see them in their own individual and diverse ways, right? Finally, it is critical that we ensure our teams are diverse and reflect the communities that we wish to develop messaging around and build relationships with. So in building a diverse workforce, that includes leadership positions, that includes hiring the people from the communities you serve, including those who are disproportionately affected, ensuring that when they're on your teams, that they feel safe and included. It's not enough to have a diverse team if the diverse members of your team don't feel that they could fully engage, even push back when they have a difference of opinion and share their life experience that could help push us to more bold, right, and brave messaging. That is so, so critical. And we see that a lot with the turnover rates in many of our organizations and institutions. And so we have to work harder to make sure our workforce and our workplaces are inclusive and not just diverse. Overall, please know that even through the divisiveness and the polarization, it seems that we can find common ground in our messaging because we all have one thing in common: time. How we use it, whether or not we put value on urgency, So getting the answers now and figuring it out now versus the time we need to truly foster relationships that build trust will be the challenge. We don't control time. We control what we do with it. And if we hope to be more prepared the next time around and connect in a more meaningful way with messages that resonate, we had better invest in that time building and repairing relationships and trust. Thank you. Thank you for that. Thank you for your time. We're going to move into our panel now and our panel discussion. So if I can ask our panel members to come up, please, and have a seat. The mics are already turned on, and we'll get started. Okay, so we're going to get started. I'm going to first ask each panel member to quickly introduce themselves, just one line, and we'll start right here.
Hello, hi. My name is Laura Garcia, and I'm a healthcare reporter at the San Antonio Express News. We are a Hearst-owned daily newspaper in San Antonio, and we serve the South Texas region.
Good afternoon. My name is Trey Duhan, and I'm the county judge for Waller County.
Good afternoon. I'm Jackie Mentor. I am representing local public health today. I am the director and local health authority at Fort Bend County Health and Human Services.
Hi, everyone. I'm Caitlin Jodalina. I think this is on. Epidemiologist and scientific communicator. Excited to be here. Thank you.
Awesome. So I'll start with the first question, and I really start from kind of how I ended in the talk in terms of that third step, like what we need to do in order to make sure we're building a diverse and inclusive workforce to respond to the needs. And so the first question is, when we think about training the public health workforce, what can we do? What can we ensure to make sure that our workforce is diverse, but then also that we're effectively engaging with diverse communities? So who wants to take the first? Thank you.
I mean, I think you start young. I mean, you don't start in your master's or PhD to get a diverse workforce. You have to start even earlier and to try to build those pipelines of students so they do end up in your master's and PhD programs. And so they do end up in the workforce. And so our workforce looks a lot more reflective of the community we're serving.
I definitely would agree with Young. And I would say, I think one of the things that's been a benefit with the pandemic involving so many people is that we have had opportunities to talk about disease transmission with groups that we may not have before. I did a book club with kindergarten through second graders on disease transmission and keeping yourself clean and healthy. And so we start there by introducing who we are and what we do to that really young group so that it starts to foster an interest and a curiosity at a very early age.
Thank you for that. And I want to stay with the same question, but I want to tweak it a little bit for our elected official and our journalists here. And so thinking about engaging diverse communities, what is it that would be helpful more for you coming from public health leadership or coming from public health that would help you to be able to effectively engage with different sectors of the community?
Well, I will say this, this whole experience has been a really interesting and trying one as an elected official, especially a county judge who is the emergency management director for their respective county. And so you have that responsibility for the health and safety of all the individuals in your county. And so you want to make sure you do everything you can. And the communication and messaging can often become very difficult. You touched on it really well, and it has everything to do with the polarization we've seen in our society today, and even how social media starts to feed you the things you want to see rather than the things that you should question. and pushes people further apart. And so in order to really effectively communicate a message, you've got to make sure you have stakeholders from within that community itself. You know, in a rural area like Waller County, which we do, I mean, we're on the edge of Houston. We're, you know, a smallest rural county adjacent to the largest metropolitan county in the state of Texas, about 60,000 people. But we're still largely a rural area. So if you really want to have effective communication, I think you've got to start probably in high school, maybe even junior high, and encouraging some of these kids to look at careers in public health so that they become your communicators and your messengers, and they have credibility because they're stakeholders in the community. And I think sometimes that's the only way that you can, because trust is everything. And we live in a society today where if there's even the perception that something's being politicized, people are not going to receive the message no matter how hard you try. And it's very frustrating. The misinformation, everything. And I see it all the time. I see it from both sides. And so you've got to have people communicating the message that people will trust above all else. And people will trust something if it's somebody that's from their community.
I think that's a really good point. But for me, I can tell you that in Beer County, which is where San Antonio is, what was really helpful was that our epidemiologists, our medical director at the county, they were themselves diverse and representative of minority groups. And so you have that visibility of folks from different nationalities and just, I mean, and ethnicities where that was really helpful. Having the medical director being able to say what they're saying in English and in Spanish was super important too. So that made it a lot easier for us to share that message and just, you know, not be always seeking someone different to, you know, to sort of make it more appealing for all of our readers. You know, it was that made it easier for us, I think.
Yeah. Thank you for that. And so to follow up on kind of some earlier themes from today, particularly around social media, right? And how we as a public health profession should think about using social media in very different and direct ways, similar to how the success of our business community partners have used it. So my next question is, in order to get our desired messages to our audience on social media, do we feel the platforms we use have a responsibility to help us achieve this goal, especially when there's a lot of noise and misinformation that is part of these social media platforms? And Dr. Jelena, I want to go to you first on this.
Yeah, so there's a lot of, I think there's a lot of issues with social media. There's these echo chambers, there's the algorithms that help feed those echo chambers. But I think that we can also really leverage it to get a message to specific audiences too. I think the first thing is to know who is on social media and which platform. If you want to get to parents, you're talking on Facebook. If you want to get to kids, you're going to have to go on TikTok. And knowing first that landscape, and that landscape is where people get their health information. In the United States, 70% of people get their health information from social media. And so we need to meet people where they're at. We need to know who that audience is. I think social media companies do have a very tough job ahead of them, but a very important one. And I think that we need to pressure them to help fix this problem. And then the other thing is that I know that you can use social media to target even more specific audiences. So for example, on my newsletter, you know, I can push it out to if there is an outbreak on the border. I did this about a year and a half ago. I can push it out to those on the border in Texas to get this information, and it helps. And so I think that we need to tell the social media companies they need to help, but we also need to be innovative and get on there as well to continue to communicate.
Yeah, I would absolutely agree with that. I also think it kind of bridges to the question you asked before. So you asked a question about how do we engage and train early. So social media changes. So what we're thinking we're using today, how we're engaging the tools of social media today will not be the same ones. Well, what time is it? Who knows, right? When it's going to be something new. So I do think making sure that we have engaged our younger group, those groups that are developing and coming up, then we can hear what is going to be the next influencing platform. And then we're prepared because we've gotten those people involved and they're with us. They're actually part of the decision-making process.
So on social media, I know that just the way that the question is framed, we're looking at this as a good thing. Social media is not where everybody is. And you know that, covering the different health inequities that there are. And I think that that's where partnering with the newspaper, with the public radio station, with all these other different outlets, Spanish language speaking TV stations, that's going to help you get your message out further than, buying and promoting a social media ad. I mean, it's just, if you look at the numbers and you look at the reach, I love social media and I'm all over it. I'm on Twitter, but I know that if I'm tweeting something, I'm probably going to have it read mostly by journalists and other sort of people in the community that may have maybe more affluent, right? The business community, not so much the people that I want to read, or that I want to reach, I'm trying to get them to see the benefits of vaccines or, that sort of thing.
So social media has been, I've used social media quite a bit. In fact, I wouldn't be sitting here right now if it wasn't for social media. I get teased all the time in Waller County when they say, "Oh, Mr. Social Media" or "Mr. Facebook." But I used Facebook when I first ran for county judge in 2014. There was very few people that used any social media in Waller County. And I quickly learned that it can be an extremely effective tool to communicate and to convey information. And I use it to this day through my county judge Facebook page. And most people do appreciate that, but social media absolutely can be a double-edged sword. And so how do you go about, keeping that in mind? How can you turn that to your advantage? I think one, you've got to some extent become an expert in the social media platforms. You have to understand, try to gain some knowledge on how those algorithms work that put those news items in front of somebody's, in their news feed. And then try to use that to your advantage, whether it's recruiting people from that can convey a message that will pop up on somebody who whether they identify as a Trump supporter or they identify as a Biden person, whatever the case may be, that drives everything that comes through their social media. And so understanding that and getting the right people to convey messages that will work with those algorithms, I think is absolutely essential. And you've got to do that. Now, as far as the social media companies, that's a tough one because, you have that fine line between, censorship and, impinging on somebody's, right of free speech.
And
that
private businesses.
and private businesses. And it too can become a problem because if people are trying, a lot of people, something pops up on their social media. They hit share before they even really think about it or look at the veracity of that article. And this, as a county judge, this is something that took up an immense amount of my time, was dealing with the misinformation that was being put out, and sometimes being put out by, again, people on both sides, people that I was close to, people that I would consider very educated. And I would look at the article and I knew right away there were things about the article that it was a false narrative. And then I'm sitting there having to literally physically have to do some research, find the information online to debunk that, and then put it out there. So for public officials, having resources available to us so that when somebody puts out or shares some article or whatever that it is a false narrative or has misinformation in it, then I can immediately respond without having to spend hours of my own time trying to find the answer. Because I am not a public, well, I guess now I've never thought about the fact that I'm a public health leader. But I'm definitely not a public health expert. I don't, I looked at this panel and I was like, I don't have any letters behind my name like this, and this is kind of scary.
Me either.
But so I'm not an expert. So I have to go out there and try to find the information myself and do my own research to try to find credible, information so that I can come back and say, this actually is pieced together, taking information from this source, and it's false. Should not be relied upon. So having resources like that available, because once an article gets put out there, it's going to make the rounds. It's going to keep getting circulated, whether it's a database or anything that I can access and get to. Anything like that would be helpful. I really don't think the social media companies at the end of the day, what they block and they don't block. I have no idea how that works, because I see things that should be blocked that aren't blocked, and things that should not be blocked get blocked. So I don't know how you solve that particular equation. I mean, I guess you could spend some time engaging with those folks as well to work on that. But it's because if somebody thinks they're being censored, that just drives them further apart, and you're never going to be able to get a message across to those folks or their family members or their friends. So.
Thank you. I want to lift something back up, Laura, that you brought up, because it kind of ties into the next question about how do we better engage communities that we have not been successful in engaging. And as you mentioned, you talked about social media and how amazing a tool of it is, but then there are also people who aren't there. There's still a digital divide, right? And so if you could talk a little bit more about some of the out of the box things that don't seem out of the box, but could be out of the box for us in our messaging that we should consider more of doing to reach a broader public.
So I recently did it was a special fellowship project with USC Annenberg, and they gave me funds so that I could do public health reporting, and it focused on health disparities. And the first story was all about communities that were disproportionately affected by COVID-19 in San Antonio. And it actually happened to be on the south side versus the north side. And part of that reporting was also looking at the resources. So for every 8 ERs on the north side, there's 1 on the south side. So it's pretty obvious the disparities there. But for me, I think that as part of that, I had a community engagement component of the project in which I had a free health fair, and it was at this beautiful clinic inside a gym on the south side, and Metro Health and a lot of the medical providers, they participated in that with me, and there was no charge, but they came out, and it was a Memorial Day weekend, and it happened actually because of the way it was scheduled. It was 3 days after the Uvalde shooting, so it was just terrible timing, but they still came out, and and it was a beautiful event. We had more than 150 people show up, so that helped. So I think that was something that was sort of out of the box. The newspaper had never done, the editorial side had never done an event. Of course, we do on our advertising side, best workplaces or all these other sort of events. But so this was something that was new, and we were kind of figuring out if it worked or not. But I think that what's really important is for this audience is to be fully engaged and available for the media. So having a county judge that's at least in tune with what's going on social media and able to post on their own platform is amazing. Having people of color and from different backgrounds being able to speak in the reader in someone's language, home language, like that's amazing. Like just having that available is really important.
Thank you.
Kim,
Th-
I'm just going to
yeah,
add to that.
yeah.
I think what's also incredibly important is that we equip our trusted messengers. That includes pastors, that includes teachers, that includes county judges. Um, I did a survey last October. Had no idea who I was talking to on my newsletter. And I thought I was talking to the average Joe, but what it turned out to be was this huge network of trusted messengers that just were looking for information that was translated as well as fighting misinformation to get it out to those people. People are not going to listen to ivory towers. They're not going to listen to Dr. Jetalina, the epidemiologist. They're going to listen to the people that they trust. And so if we can equip those people in a very easy way and a meaningful way, that is going to do a lot to get to those communities. And I truly think that's the biggest place we can make the bang for a buck.
Can I add to that? As much as we tend to sometimes rely on social media because you can convey information to a large audience, there's still not really a replacement for face-to-face communication. And you do have a segment out there that don't use social media, and they're hard to reach. And you really do have to kind of think out of the box and figure out ways to reach out. And I'll give you just one example. You know, Fort Bend County Wheels on Meals services Waller County, and they have hundreds of folks that they bring meals to, hot meals. And a lot of these folks are at home. They don't have access to a computer or social media. But then once a week, they do a luncheon where those folks can, if, you know, and for them, it's a big deal. That's the one day that they probably get out, they drive their car, they go to the community center and they have lunch. And there's some social interaction, and you have an audience there that's very difficult to reach. And if you just you could have somebody there to speak to them and do some outreach at that kind of event. There's just no replacement for that. So engaging the pastors, the folks that are the faces in the community that know those folks, that can communicate to those people, that's invaluable.
And if I could speak to that, I'm gonna, obviously I work very closely with our county judge as well. Public health is local. And when we talk about having, I think sometimes there's a challenge when we separate trusted messengers from ourselves. What we really want to do, and maybe this gets back to the original question, is having even our professionals be trusted messengers in the arena that we exist in. And also, you know, as county judges said, also maybe broadening our view to who is public health. If we're all public health, if it really touches everyone, then maybe we shouldn't be a clique or an organization that says we need to find trusted messengers to teach our message to so they can give it to their people. That doesn't sound very inclusive. We are all the public. We all know that COVID has affected all of us. And so we all come with our own biases. We all come with our own groups. We all come with our own background. So when we think about all of us, public is public. And so I absolutely agree with the fact that there are groups that we are engaging with all the time that they're us. Those seniors, we've been engaging with them all along. And so we have to make sure that we think about our public health message getting to us, to our neighbors, who we are, instead of how can we reach them? How do we reach ourselves? By bringing ourselves inside, they're part of our group.
Yeah, that statement that you just mentioned makes me think of a quote. If I came here to think I was going to liberate you and not myself, then I'm doing the wrong thing, right? And so we're all a part of this, right? And so how do we keep ourselves into the connection for the relationship building, right? Which gets me to the next question before we open it up, because I'm sure we have, as I see the head nodding, questions online, right? And so the next question around building and strengthening the connections in a more meaningful way. knowing all the limitations that we have on time and funding and human resources, does anyone want to share any strategy that you think or you're considering that we should be doing more of to help build relationships with diverse communities?
Just gonna, one, you have to be empathetic when you're having communication, and then two, you need to listen. We've been doing a lot of telling because time is lives during a pandemic, but you have to stop and listen to concerns because there are legitimate concerns out there. And if we need to reach them, we need to listen. And so I don't know what that means for individuals. I mean, opening up a question line, finding questions, actively going out and participating in conversations has to be part of the solution.
And I would add to that, that we need to take the long view. We need to be thinking about the next one, not this one. What's done is done. Certainly, we need to do what we can. I mean, obviously, there's still lives to save. And I'm still confirming deaths due to COVID right now. So that's not to take that away, but we need to take the long view. When we take the long view, it's less of the box checking about innovative ideas for today. It's more about that trust, that relationship building. That doesn't occur in a week, in a month, till the next surge. It occurs over years, over decades.
I would say some stuff that I saw in Bear County and that I had reported on. I was reporting on a city councilwoman who, this was early on in the pandemic, and she was trying to reach out to her constituents in her district, which is a majority, I think it was more than 80% Latino, mostly Mexican American, Spanish speaking, a huge digital divide. Most of them did not have a computer at home or internet access. And so what she decided to do was she was getting messages on public utility bills. So she was doing that. She did actual paper door hangers, just different, getting on the church bulletins and on the church, so there's just really all kinds of, it sounds super. I know when I was doing my project, I literally got volunteers out and posted up flyers, on outside of dollar stores, liquor stores. I mean, in the neighborhood. So, all those things, they work too.
It's a hard one. I had to think about it quite a bit. The one thing I will say is, in order to address it, is doing what y'all are doing here today. And that is discussing what has worked, what hasn't worked, how can we do it better, what can we do different, and having these kind of discussions on an ongoing basis, because we can sit here today and say this would be effective and this didn't work. And 6 months from now, because we live in a society where technology is, it's at such a pace that the platforms 6 months from now could be different. The way people communicate could be different. And so you constantly have to do this. And this is going to be something that we don't just do in response to COVID. We need to be doing it as an ongoing thing in response to whether it's emergency management, whether it's a pandemic. I mean, now, you've got monkeypox on the horizon, that's, and right now still people, they hear the TV, but they really don't have a clue as to what monkeypox really is or what it does. So we're going to have to constantly challenge ourselves and look for opportunities and ways to do that. What I've found that has worked really well and what I'm going to continue to try to do is just basically convey and provide the information. I'm not trying to, because if people perceive that you're pushing an agenda or you're trying to put people, it's like, then they'll shut down. And so from my standpoint, it's making sure the information you provide is credible, and then encouraging people to do their own research, encouraging them to make decisions that are right for them, right for their family. And I found in Waller County, I think it's been a very effective strategy. we were very hands-off during the pandemic. I had, some CEOs of some major hospitals in Houston that were very upset with me because I wasn't shutting things down as much as they wanted us to. And then as we get down the road, there's an article just recently about how Waller County, little old Waller County, the Houston region had one of the lower, infection rates and fatality rates compared to a lot of other areas. And Waller County actually was leading the way of the Houston area counties in terms of having the lowest infection rate and lowest fatality rate. Now I'm not going to say that had to do with my communication, but it probably had a lot more to do with the fact that I always joke that Waller County invented social distancing. We have a little bit more space in Waller County, which probably does make a difference. You just have less points of contact during the day. There's less people in our grocery stores, and that probably has a lot to do with it. But we've done that. We provided the information, and we encourage people to make the decisions right for them. And I think a lot of people made the right decisions, and it did okay. And we didn't. I just wasn't going to shut somebody down and tell them they can't earn a living. I mean, Waller County, some of our mom and pop folks, that's devastating to them to not be able to operate a business. So, but you got to put some trust that people can make the right decision if they have good information.
Thank you. Thank you all. I think it's time that we open up questions for the audience, both here in person and virtual. So if we can go virtual, let's take a question from virtual first, and then we'll come to the audience.
Great. Thank you very much. This question relates to debunking misinformation. Is it possible that the process of debunking legitimizes the misinformation and the source of the misinformation?
Sometimes, I mean, it's really hard. I think that it's really hard because it's like you have to weigh, okay, if this is really spiraling out of control where it's going viral and a lot of people are believing this, then you really, it feels like you have to address it. But I think the way that you address it is really important,
That's exactly right. Like there's a right way to combat misinformation and there's a wrong way to combat misinformation. So for example, you don't share the article, you take a screenshot of that article. So people recognize what article you're talking about, but that article doesn't get more clicks. Or you start with the truth. You start with the kernel of truth and then build off of that. And so there's definitely a right and a wrong way to do it too. Yeah.
I would agree with that. I know one of the things that I tried to do was when information would come that was very challenging for us or challenging some of the truth to us, I would treat every question as a legitimate question, and I would treat it with research that I could do and give them the answers back. And it took time. And I got criticized by some of the staff because some of our staff was wondering why I would spend so much time, like late into the night, saying, thank you so much for your question. Even if it was an attack, even if it was very negative, even if it was very personal, it's thank you so much for your interest. And then making sure I wasn't repeating, some of the negative information, but taking time. I will say so this is going to reveal, my ignorance. So I got a series of questions from one of our elected leaders, and it was probably, maybe 30 or 40 questions. And a lot of them were based on information from a Dr. Droid. So you all probably know who Dr. Droid is, but I did not. So I'm looking at, all of the questions, and I actually took the time to read through all of the questions and then use my network. And so Ed Septimus was very helpful. So he answers every one of the questions, pulls out the truth in some of those articles from Dr. Droid. So literally both of us read every single article and then responded. And when we responded with the background that Ed Septimus has. And I was clear. I'm sorry, I'm not familiar with Dr. Droid and his credentials, but here's who, who I work with, and this is the information that we get. And where we could find common ground, we absolutely said, oh, yes, this is something that we've seen. And I think that's, as they were saying, it's very important to treat even that disinformation with respect, because if you don't, I mean, it's got its own following, and so you want to treat it with respect as well.
I think it's important to sometimes you have to discern what is patently fake news and what is something that's a legitimate thing that even experts could disagree on. Because with the fake news, where, for example, somebody has taken a finding from a report and they're twisting it out of context, or they're totally or changing part of it, and it doesn't actually represent what that study, that you have to respond with, and you've got to give the information and the facts. Point people to the original, point them so they can look at it for themselves and see that this has been taken out of context, that it is a false narrative. That's one thing. And then also when you have people where there can, people that are both all experts in a field disagree on whether you do this or you do that, then you just have to, it's not so much pointing out what's false. It's just saying, you just have to do your own research. Here's the information from this side and here's the information from this side, and you have to decide. And sometimes that's the problem, because if you try to kind of go, if you pick a side on where it's just experts disagreeing, you're probably going to lose credibility, and then you've lost the ability to communicate any kind of message. So sometimes you have to really kind of pick and choose. But when it is something that is false information, that's what I went back to earlier. It can be exhausting. I mean, I can't tell you how many times during this, and let me say this, as an emergency management director, in my first basically 2 years in office, we had 5 FEMA events in Waller County, including Harvey, so 3 years. So I was doing nothing but emergency management my first term. And I thought I really became an expert on emergency management, and then COVID came along. And that completely blew all of that out of the water and was far more challenging, because it was all consuming, all hours of the day. The information changed day to day, and trying to stay up to speed, trying to communicating with our public health officer, Dr. Placencia. I mean, and then I'd be up until 3 a.m, literally trying to do the research because I saw something, and I know what misinformation can do. I know what it can do during a wildfire. I know what that can do. It can cost lives, literally cost lives. Misinformation here can cost lives. And my wife is like, for the love of God, go to bed. And, and I'm like, I've got to get this put out there, because I can't let that just go without being challenged. And that's where for me, if I had some resources behind me, where I can, and timing is everything as well, because I mean, it's not like I can send you an email 3 days later, you get me back all the stuff. At that point, it's already gone to 10,000, people across the county. Time is everything. And if the faster I can respond, then I will stop that many more people from hitting that share button. And that's important.
That is so important. Also, keeping in mind that just, not everybody knows that journalists, and particularly at different outlets, you have different deadlines, right? So there are TV journalists who they have to get everything done by a certain time so that it can go on air. So if you don't have anybody in your department that's available that can quickly, clarify or answer their question, that's going to shape their coverage, So there were times where it was like, oh, thank God I got someone 3 minutes before my print deadline. And sometimes my understanding, and I'm a healthcare reporter, I've been doing this for 8 years. So I do have more of an understanding of the science and some of the terminology, but still there are times that I don't understand things, and it's something that came out really quick, and then I have to get it to print. And so I think that's a challenge. So being available is really important. Having folks that you trust, and having those relationships already so that I can email an epidemiologist and CC their media person, and they're okay. They trust that, they can contact me right away.
Thank you. Can we go to the audience for questions now? Are there questions
Sure.
in the audience?
Yes, we have a question here.
Oh.
So as Dr. Jedalina, saying that right, brought up, you use social media as a tool to reach other people. How do you decide what message you're going to give via TikTok or Facebook? Because like you said, you use Facebook to reach parents, you use TikTok to reach kids, and then I guess Twitter is everybody in between. So how do you decide which message you're sending where?
Oh, that's a good question. Just to clarify, I don't have time to do it on every social media. I choose Facebook. That's where it started. And now I have a newsletter, so it lands in your inbox. I'm also, on Twitter and Instagram. But how I decide what goes out is by listening to the questions and anticipating concerns. A lot in the beginning of the pandemic was fighting misinformation, that mRNA is going to change your DNA, all of this stuff. But equally important is also proactive communication, anticipating that the kids' vaccines coming out, what are parents' concerns going to be? I'm definitely not a county judge or anything, but I starting to get stage fright when you start thinking about the number of reads and stuff. And so how I just think about it is, what would I tell my sister and my mom? They were my first audience. And what's going through my head and walking people through that, I guess, is how I decide what to put out there. Other than that, I have no idea why it's working.
Do the same thing with my writing. If I think that my mom or my grandmother won't really understand this, then I have not done my job in really just trying to translating that science for real people.
We have a question here.
Hi. So one thing we learned pretty quickly was that the general public doesn't have as high of a health literacy as the rest of us do here in this room. So how do you take very complex topics such as the vaccines, COVID, immune response, and bring it to a level that the general public can understand, or maybe, people that have a low health literacy?
Well, I can speak to what happened. I don't know that it was super intentional, because early on, you're not aware, that of what you've just said, what we've learned. So what we ended up benefiting from was a very educated public that wasn't actually working in the pandemic at the time. So we would put things out that people would have questions about, and we wouldn't see them. We were resourced very tiny. So we wouldn't see all that was going on social media, but educated people, parents, people in the public, people who were in other industries would see it and actually translate for other people on social media. And I don't know if you all would see that, but because I'm not on social media, I wasn't on social media at all at the time. I mean, just because we were working so many hours. But we would put certain messages out, the questions would come, and even before, we would have a communications person or someone who would see it and then say, oh, we need to answer this. We could see that the public was actually answering and answering well, and we just kind of stayed out of it, because that way our message was there, and other people, neighbors, friends, people in the public that they knew, people in their same neighborhood on next door or wherever else, they were becoming those people who would give very accurate information, because they could translate. They knew what was going on. Scientists in our neighborhoods and in the community, lots of engineers, people that would actually understand and be able to translate for the community. So for us, that just kind of happened. I mean, we didn't do that. Then we would actually connect with those people who decided, they took it on themselves to be those voices, and we would make sure that they had the right information and that they would have easy access to us to be able to make sure that they were giving correct information.
It's a really good question, because the problem is everybody thinks they're really good communicators. And some of the most brilliant people I know are horrible communicators, and they think they're communicating. And I've learned, I've been practicing law for 25 years. And one of the things that I did in my law practice that I've kind of taken into my role as county judge, and that I've gotten a lot of very positive feedback, is taking, complicated or complex kind of situations and breaking it down and making it real simple so just about anybody can understand. So a third grader could literally understand that. So how do you, if you're in a position and you're, extremely smart, and you're very knowledgeable, how do you know if you're conveying it in a manner that can be understood? And the way I do that sometimes is I will, before I post something on Facebook, I will, I'll ask my wife, or I will ask, somebody who has no knowledge of that area. I'm like, can you tell me if you understand what I'm trying to say? And they'll read it and they'll go, a lot of times they'll say, yeah, you made it really simple for me and I understand it. Or sometimes they'll say, I have no idea what you tried to do or what you're saying in this. So you've got to get that kind of feedback, because you may think you're doing a great job of communicating, but you're just not, you're going over their head, because, and we all do it. I mean, God, go to emergency management conference if you ever get a chance. The acronyms are freaking ridiculous, and the EPD is coming to do an SIS, and I think I have a CDL if I don't, and I'm like, okay, can y'all just talk in English? Can we do that for emergency management purposes? How about we get rid of the acronyms and talk English? And sometimes it's hard to do, but you've got to at least have some sounding board, so that if you're trying to communicate, it's being received in a way that it can be received by everyone. And that's in my job as county judge. I have a wide audience, every background, education. I've got to break it down to where everyone can understand the message I'm trying to convey.
I think sometimes it's just saying the same thing in a little bit of a different way. So think about just the words that you're using. If you're saying there's X amount of cases in this county, okay, cool. How about there's X amount of people currently hospitalized? You know what I mean? Like, so a way to sort of, you're saying the same thing, but it's like you're saying people instead of cases, or I think there was the way that we said like that people were on ventilators, right? Do people know what ventilators are? I mean, kind of, right? It's a machine, right? And so I think the way that we had phrased it and this changed throughout the pandemic, because we saw that, as we were covering this, we saw, okay, we need to explain this. And I think that we said, that require or that need to be on ventilators to breathe or something like that, to explain to regular people what that means. I know that y'all all know what that means, but so that's helpful.
And if I can add, and here's the hard part. Sometimes doing that means you have to go the long way. It's not something, like I had Twitter. I used Twitter as a platform at one point in time, and I really had to get away from it, because when they were limiting how many characters you could put, I can't communicate like that. I cannot break something down into simple terms in 140 characters. And so, it's just, sometimes you're going to have to take the time to break it down and explain it. And there's not any other way around that other than to communicate the message. It takes a while sometimes.
Yeah. Let's go back online for another question.
Great. Thank you, Kim. We have a comment that was posted online that I think that the panelists might want to discuss.
Mhm.
The commenter says, please don't say, quote, do your own research. Instead, the commenter states or suggests, do your own reading and listening. The commenter further says that he got tired of people, he doesn't use the word people confronting me while wearing a mask in public, telling me masks aren't needed because I've done my, quote, own research. Would you like to comment on that?
Well, I think that's a really, really good point, because, and I was thinking about that when I heard that, people think they're doing their own research, but they don't always realize that the sources that they're going to are not reliable and they're not reputable or credible. And so that makes it really hard. I think, especially y'all's job in public health is trying to, anytime you say do your own research, okay, well, they did. And then they happen to be on a website that's, targeted for anti-vaxxers and everything's a conspiracy. And I mean, it's really difficult.
No, I can appreciate the comment. And usually when I'm posting and I'm encouraging somebody to do their own research, I really don't leave it at that. I usually go into a little bit more. I'm like, when you see information, you need to check the veracity of those statements. Google those statements. Google the doctor who apparently made that statement, or look at the report, look it up for yourself. I mean, I actually do go a little further to kind of explain what doing your own research actually means and what that entails. Now, a lot of people are probably not going to do it because we also live in a society where, I'm more concerned about, the beating morning traffic or whatever the other cases are that are things that are right in front of us, than spending that time. But I mean, that's what you have to encourage people to do, so that they can reach their own conclusions. And you're right, because if you say do your own research and they go, well, I looked at my news feed and this is what it says, and that's not doing research. So research means you actually question the veracity, question things that you're being told is truth. You should question them, and that's on both sides.
Are there other questions in the audience?
If I could just speak to the research as well, I will say that I have evolved in not letting the hairs on the back of my neck stand up with the statement, I did my research. So I can, I understand kind of where the person is coming from in a sense. I grew up in a household where I watched my parents get their doctorates. And this was in the dark ages when my mom was typing on the paper that had the copy, you guys are young, but the copy paper with it, I smelled it, in my house, right? And so I was an engineer before, I went into something else. So my definition of research, it's not the same. And we have to, I can't stop people from believing that they've done research because they've read 16 Facebook pages. I mean, that is literally a new definition of research. So I've kind of had to take a deep breath and say, you know what, this is truly what they are calling research. It is not the same as what I'm defining as research or what people in this room are calling research. And so I think what Judge is saying is he's trying to make sure that people do their reading, as you're saying, but we kind of have to maybe accept that the definition that we accept has changed in the
Correct.
public, and that humility, we need to be there. If we're not there, we're not going to be communicating with our public.
And also just be cognizant that, not everybody has time to do research. Not everybody has time to do all this reading or has the access, even the internet access and it's not that they are focused on, trivial things. There are people that are trying to put food on the table that are working multiple jobs, especially during COVID-19, and so it's not super fair to expect people to do this kind of research. I think it's on this profession and it's on journalists as well to be able to communicate and distill the most important messages that they need.
Hi, I was just had a question about, obviously misinformation and doing your research and these articles that I guess you can kind of you can call it subjective on that research on what they decide, what they choose to believe. So my question to you is, what would you, to the layperson out there, when you say do the research, where are you directing them? And where is that legitimate, where are those legitimate articles? How do we communicate those to the public in general? Those credible news sources, if you will.
I mean, I don't want to be self-serving, but most most news outlets are doing their due diligence. I think that, we have a code of ethics, the Society of Professional Journalists. It's something that we adhere to. And so we're going to fact check and we are going to ensure that we're not putting out false information, that we are getting it from a reliable source. That said, it's still very hard because, things change from day to day. I can't just, simply say, oh, well, go to a .gov website. Okay, great. But we know there's a reason why my profession exists is because there are times that the government is not always telling the truth. So you see all of these .gov, these news releases from, our past presidents sometimes, and you're reading it and you're like, that is not accurate, and so as a journalist, I'm trying to figure out, like, should I, if I quote this, like, do I just immediately refute, well, this is totally false, but this is what they said, I mean, it makes it kind of gray.
Generally, if there's an article that's been put out or whatever the case may be, what I try to do is at least point people to the sources, put the links in there to say, here's the study, or, here's this, look at these information. You got to read it. And then that's how you decide for yourself. You go to those kind of information. I don't just say, do your own research. And then, because most people will not, but a lot of times if you will point them in the right direction, you put the links there that's available, they can click on it and go look at it. Some folks will do it. There's a few. A lot probably won't. But even if you reach those few, it does go a long way towards, them, instead of hitting the share button, and then it exponentially goes to their 100 friends, who then goes to 1,000 friends, and then goes to, 10,000 people. You've made a difference. So you've got to just, you give them the information and let them go and read it. You try to spoon feed it to a certain extent. And that's the thing that worked best for me. And again, try not to come across as, I'm trying to push somebody here or there. Here's the information. Here are the facts. Whether it's a wildfire or it's fresh. And let me say this too, as a public official, early on in the pandemic, we were trying to do everything we could to make sure people stayed safe. And it was in the information and everything that we knew about the virus changed almost daily. There was a point, whether you call it fatigue or, where there would be differences of opinion where I just didn't know. I was more knowledgeable than most people because of the information available to me. And I just didn't even know where to come down on on an issue. So at that point, you're just going to have to give them the sources and let them go and decide for themselves if they choose to do it.
We have an online question.
Sure.
Okay.
I have plenty. This question might be best for you, Kim.
Mhm.
How do you see the pandemic impacting clinical employee relations? Do you see a potential for more collective bargaining efforts? And this particular questioner is specifically talking about nurses in Houston.
Yeah, I don't. Anyone? Yeah.
So if they're talking about nurses in Houston, not as though I'm an expert, but I have been working closely with the University of Houston College of Nursing, talking about the critical shortage of nurses. And I think if the question is about engaging that staff, particular sectors of our direct healthcare environment, I think that what we're doing here is also done in that arena as well, launching those critical conversations and trying to make sure that we are listening to those needs. In the conversations that I've been involved in, it's taken that the TMC, hospitals, Texas Medical Center, hospitals, CNOs, and CEOs to engage them in conversations about how other parts of the healthcare sector and the community can make sure that we are putting efforts into getting the right numbers of nurses in the pipeline, educating them, talking to them about what this career looks like over the long haul, and then also talking to those who are currently there, who are burned out, who have not felt like they have been empowered or treated very well, engaging them in conversations about what that does to them, for them, and how things can be changed in the future. So I'm not sure that that's directly answering the question, but to let that questioner know that those conversations are being had at the level of, where nurses are being utilized mostly, and then also where they're being educated and what that's looking like.
So if we have time for one more question, if there is one. Okay. Thank you. Thank you so much. I want to give it. Oh, sorry. There is. Oh, okay. Okay. Come on. Thank
No,
you.
there's a question.
There's a lady.
There is a question.
Oh,
There's a lady with a microphone.
Yeah, we have
Oh,
one more
I'm sorry.
question in the
Thank
back.
you.
My eyesight's
Okay, thank you. I love this conversation because for me, it just feels like democratizing public health is kind of what's coming through for me. And Dr. Baker, when you started speaking, you talked about that it takes a lot of groundwork to develop those relationships before you're able to kind of respond to a health problem. And so, maybe we didn't have the civic infrastructure that we needed before COVID to be able to respond in a way that would have been really helpful for us all. So I wonder what parts of public health as an industry are we set up to respond in a way in the future? What would we change about public health and how we're set up and how we work with communities to be able to better respond to health challenges in the future?
Yeah, so I could just quickly say, so it's more of us being more proactive than having to respond, right? And so thinking about ways that we are investing in the human resources and the human capital to be able to do the work of building the trust and the relationship building. Somebody has to do that work if we say it's valuable. So we have to invest there because we know that in the long run, we're talking about the long game, we're talking about not checking off a box. That means not just showing up and having your focus group and saying, hey, you like this message? Okay, bye, I'm gone, right? That can't be what sustains relationship building for the whole of the public. And so we have to have or figure out ways that we develop, whether it's through the pipeline and being more innovative or branching out with our partnerships, and so that we're all accountable to that relationship building, and it's not always the public health experts, right? And so we continue to do that and do it well and be consistent there, and just don't give up, because this is something that I think we all think is critical and valuable to the future of public health. Thank you for that question. Thank you. And I just want to give a hand clap to our panel. Thank you all so much for your answers and your thoughts.
I'm going to be very brief with the closing remarks. I tried to synthesize 3 lessons from today. The first, and actually the winning t-shirt for the day, goes to Judge Duhan when he said, trust is everything. And, I thought a lot about it and tried to break it down. The first part of it was, it's clear that public health, healthcare will be partnering with, trusted partners in the community. Whether, the faith community was mentioned, I think one of the things we don't talk enough about is the trust between a patient and their primary care provider. I think is another place we can build off of. But that does not release us from the obligation of building trust ourselves within the profession. And that does not happen overnight. I think Dr. Minter said that very well. It's going to take years, and we need to keep working on that. So that to me was lesson number 1. Lesson number 2 is good public health communication does not just happen by accident. We need to learn to communicate with a purpose. We need to know our purpose. And I think, we heard, I think very nicely, that purpose probably should fit in a line. The purpose can't be summarized in war and peace. And we need to know our audience, who we're communicating with. And the third and final, I think, lesson, maybe the most important in some ways, is to be humble. I think if COVID taught us nothing else, it's to be humble, and admit that we're going to make mistakes, and we need to learn from our mistakes. The wise people learn from their mistakes. Don't hide the mistakes, but learn from them. So for me, those were the three important lessons from today, and today is a first step. I think it was a very successful meeting of bringing together many people. I want to thank those virtual people who joined us virtually. I appreciate you being here, appreciate you. For those that are here, I have a very important announcement. You all think of TMC Inc. as the largest medical center in the world and certainly one of the best, but really it's the most efficient parking enterprise in the world. And it's very, parking is everything around here. So before you leave, make sure you visit the front desk. There's parking vouchers that will get you out, get your car out of jail free. I want once again thank our speakers, thank the audience. It was a great day. Please drive safely on the way home. Appreciate you all.